Good evening, sir.
Good evening to all. This is Chandra Mohan, ortho physiotherapist from Sri Samraj Physiotherapy Center, Dindivanam, Tamil Nadu, India. A warm welcome to all for the ExRxIndia's and Sri Samraj Health Services Private Limited's presenting a webathon, a web series, enthusing for the world record in the field of physiotherapy, not just counting the topics, but responsibly, we are providing knowledge for the physiotherapist in India and 25 other countries. Apart from this, ExRx India and Sri Samraj Health Services is providing online OG consultation for the women's health issues in association with Pickle Studio, Chennai, Dusat Creations, West Bengal, powered by Fitness and Rehab India YouTube channel, Lalit Academy and Research Center from Karnataka. ExRx India's
Sir, you.
in COVID. Am I audible?
Yeah, sir.
Yeah. Today's ExRx India's topic is CPR in COVID. Will be presented by Dr.Rejisha, Associate Professor, Department of Physiotherapy, St.Johns Medical College, St.Johns National Academy of Health Sciences, Bangalore. I welcome ExRx India team members Dr. Rupesh, Dr. Vairav, Professor Duna, and her friends. And thank you guys. Thank you for bearing with us for these many days, every day evening. And we killed you by lecturing you. Today we are going to save you by giving CPR. Okay, tomorrow we are having celebration. So thank you all for the cooperation. Let's go to our session. I welcome Dr. Rejisha and request her to commence the session. Please, madam.
Thank you so much, sir, for giving me this opportunity. Just let me share the slide. Okay, is the slide visible?
Yes, ma'am.
Yes, ma'am.
Okay, so if I can request all the participants to switch on their video so that I know what you're doing, because this has lots of hands-on techniques. Lots of things have to come correct. So if I can at least see who, your video, that would be nice. Mute yourself and put on the video.
In case if you are making sounds with your mic on, we will remove you and you have to follow us through YouTube only. My kind request to all the participants, in case if you are disturbing us with mic on and we don't give any warning, we will remove you. Sorry for the inconvenience. We want the session to go without any disturbance. Please carry on, madam.
Okay, so before we start today, let me give you a brief introduction about the unit called as JeevaRaksha. JeevaRaksha is basically a CPR protocol, which is made by Indian emergency physicians. The CEO of this JeevaRaksha is Dr. R.K. Nair. And it has some of the most wonderful, accomplished emergency physicians, both from India as well as from abroad. So it's not something that isn't capable of standing across with AHA, but something made in India for Indians by Indians with the guidance and support from Dr. Peter from abroad. Okay, so this is basically a collaboration between Rajiv Gandhi University of Health Sciences, Bangalore, as well as the University of Utah, Sri Vivekananda Youth Movement. All three of them have come together in saving lives. How it came about is that when the statistics of emergency medicine and emergency medical management was taken out, it was found that not everyone was able to actually save the patient even after coming to ER. So that put a doubt in the capability of the medical system. So these doctors came together, wonderful people came together and put a protocol across, and all the doctors, especially in Karnataka, under Rajiv Gandhi University, which all colleges are there, all of them are getting trained in it. There are a couple of things which differ from AHA protocol as well. When we compare it to JeevaRaksha, there are a couple of things which differ, but it will be very easy for you all to understand it. So that is how JeevaRaksha basically came about. Okay. So today I'll be talking about this is actually a 3-day course, BLS course, Basic Care and Life Support course, which is conducted by JeevaRaksha under RGHs across. So even if you are an MBBS student, BDS student, BPT, pharmacy, all the allied health student, if you need to get your graduation certificate from the year 2001 on to 2000 and 2001 or 2021 and 2020 on, right? You need the certificate from JeevaRaksha as well. So we'll just carry on with today's class. What are the aims of this particular class? One is to learn what are the common emergencies that we come across, especially now the importance of physios in community health is very, very high because of the current COVID situation, right? So anyone with a bit of medical knowledge is very important right now because it can make all the difference between life and death. So it doesn't matter how good a doctor you have in the hospital if the patient arrives dead, right? So often it is not the doctors who are the first responders. It is it's the layman, it's the citizens of India, and sometimes if the patient is lucky, maybe someone who have a bit of medical background. So then the importance of CPR in physiotherapy is much more, especially in COVID era. So we'll be talking about some of the medical emergencies that we'll come across on a day-to-day life. We will learn cardiac resuscitation. I'm really sorry it is not a practical session, but how much ever I can put across my knowledge to you all, I'll really try for that, including the safe use of a defib, which is very much available in any places where more than 100 people come across. We will be learning how to save a person with a obstructed airway as well. Okay, so what are the objectives? To know what is a medical emergency. Sometimes what happens, we tend to be called on to site saying that there is a medical emergency, but when we go there, it might not be an emergency at all. So we need to know what is a medical emergency, learn how to, because the emergency situation is so tense and we need to apply our critical thinking to that particular situation. Okay, we should be very, very careful how we are thinking. Each step that we are going to do is going to determine if the patient is going to leave or he is going to lose his life. So we need to learn communication skills if we are on the spot, and we need to take up the role of a team lead. How do we do that? How do we command other people what to do and what not to do? Okay, so that everything we'll be looking in today's session in a brief to us, hopefully to us. So this module has 4 sessions. First is common emergencies. Second is ensuring scene safety and primary assessment. Third one is your cardiac arrest. What do you do in case of cardiac arrest? How is the compression given? How is the AED given? How is it applied? Everything will be talked about. The last session would be the airway obstruction due to choking. We'll run to session 1. Common emergencies. This we have already seen it. So we are looking at what all common emergencies are possible that we will be called upon, especially in COVID. We need to look after our safety. We need to look after the safety of the others who are around. We need to look after the safety of the patient himself. So all these things becomes important. Understand simple interventions that can actually stabilize the patient well. Okay, so these are the main objectives. We'll go. So what is an emergency? Any condition which threatens the life or well-being of a patient can be called as a emergency. Okay, but the patient perception of emergency might be different. So this is based on the layman's knowledge. So a person's emergency level. 1 minute. Yeah. Thank you. The person's emergency, when a layman is concerned, if someone faints, that might be emergency for them. But when we go and look at it, it might be just a simple syncope, right? So the person's perception, a layman's perception of emergency is different. So when we actually go there, it might or might not be, may or may not be a actual emergency. Sometimes reassurance is all that we need, right? So, what are the common emergencies? First one, and the one I'm going to talk in detail, is the heart attack. Okay, snake bite or any venom attack, stroke, injections, infections, sorry, not injections, infections, diabetic collapse, fits, fractures, wounds, burns, and life threatening bleeding, right? So these are some of the most common emergencies that we come across. We'll look at it one by one in a very brief content. Okay, if it is a heart attack, how do you recognize? It's not necessary, as we have already learned. It's not necessary that the person who is undergoing heart attack always have a chest pain. If the person is having diabetes or overweight or smoke, or is a person already used to having a left arm radiating pain, then he might not actually pick up the chest pain to be a cardiac arrest. Okay, even though classic sign of cardiac arrest is a chest pain, it might not be always there. Okay, what do we do if we go? I'll be talking about this in detail, but reassurance and aspirin saves life, isn't it? Then we have to rush the person to the ER department, where further follow-ups will be done, ECG, troponin, blood test, all these things will be done, and depending on the patient's condition, further management will be talked about. Um, so the most important thing in making a person leave is good CPRs, okay, chest compressions or cardiac massages, what we say, that as well as the availability of AED. Not only availability of AED, but also how we are using it. Okay, I'm pretty sure all of you could have gone to movies, to malls. You could have seen a red box, but have you ever learned how to do AED shocking? No. Any place where there is a chance of a group of people coming together, by the government of India, it is a rule that AED should be there. Couple of days back, there was a couple of months back, there was a news in this thing telling that a passenger in the airport had fainted, and he was actually having a cardiac arrest, and there was a doctor who was present, and she's used AED as soon as she came across the patient, and the patient actually survived. So that is, that is how important AED usage is, and something that all of us should be knowing, especially coming from background medical background. All of us should be knowing. Stroke. All of you will be knowing about FAST. So I have not me the this thing the institution have added a little more. Be fast, okay, where B is the balance of the patient which is compromised. Eye, blurred vision will be there. Face, there'll be deviation or drooping of face. Arm or leg is not working as they want them to work. Slurred speech, and time to call for ambulance immediately. Okay, so that would be the main things of a stroke patient. Okay, if you are coming across a stroke patient, please remember, be fast. Okay, so if it is a snake bite, what do? We call it do it right. Okay. First, reassure the patients. About 70% of snake bites are non-poisonous snakes. Okay, they are not poisonous, so they are not going to harm you. Out of the 30 percentage of snake which are poisonous, only 50 percentage actually inject poison when they are being attacked. Okay, so the chances of a person who got a snake bite to have a real emergency is very less. Okay, very recently in Kerala there was a very famous case called as the Uttara case, where Uttara was a wife and she was bit by two poisonous snake in consecutive weeks. Actually, that was a murder plan. So even when the husband had done that, and the husband talks that, okay, fine, I did throw the snake on top of her, but the snake didn't bite her. He literally had to provoke it to bite her, and that too he had to do it a couple of times to bite her. Okay, so not all snake bites are poisonous. So reassure the patient that you are okay. We'll take care of you. Okay, immobilize. Immobilize the extremity or and as well as the person. Okay, if it is a hand that is, leg where the snake has bitten, then you just immobilize the leg as well as the person. Okay. Please, we have seen in almost all Hollywood movies and Bollywood movies talking about tourniquets or ligatures being tied around. Don't do that. They can actually harm. Cutting. So what happens is, we tie a tourniquet and take the person to ER. Come to know that there isn't the snake wasn't poisonous at all. The person is okay, but then because of the tourniquet, there was no blood supply to the tied out part, and that part got gangrene, and there was further amputation also happened because of this one particular thing. So don't tie a tourniquet around the leg or hand or wherever. Okay, get to the hospital immediately. Do not waste any valuable time. Take the person to hospital as soon as possible. Traditional benefits where snake was called to take the poison out, or you suck on it. All those things are not going to work. Please don't do it. You are probably putting yourself also in danger by doing it. Don't do that. Take the person to the hospital as much as possible. Tell the doctor about the symptoms that the person had. Okay, whether there was bleeding or weakness or pain, whatever it was, you talk to the doctor about the symptoms. So what happens when you once you go to the hospital? They're going to give you anti-venom, which has anti venom of 5 poisons. Okay, so it's not dependent on which snake has got or bitten the person, bit the person, but it it comes in a small capsule. I mean, a small ampule. All the 5 pentavenom, the penta antivenom it is called. All the antivenoms will be that in that one particular injection. So it doesn't really matter if the snake was of one, whether it was a rattlesnake or a cobra or a king cobra, doesn't matter at all. Okay, you can just give them that one particular antivenom. So that's the reason. Don't go behind the snake. Okay, take good care of the person who's the victim. Calm them down. Don't scare them, because actually scaring the person, already they'll be scared because a snake have attacked. So scaring the person actually takes your heart rate high, which makes the poison reach places faster. So as much as possible, reassure the person and take him to the emergency department as soon as possible. If you have controlled massive bleeding, okay, how can you save a person who is having a massive bleed? One, direct pressure onto it. Okay, you can take available cloth, put on the wound and have continuous pressure on it. You can apply a tight dressing, okay, or a tourniquet. Here you're supposed to apply the tourniquet above the level of bleeding, so that the bleeding will stop. Okay, don't apply over the joint, because the moment the joint moves, it becomes loose. Okay, and there are chances of the patient actually bleeding out. um, the tourniquet should be at least 3 to 4 fingers of width. It should not be a thin one, which can create a massive injury at that particular place. It should be at least 4 fingers or 3 to 4 fingers breadth. Okay, so you can see here on the leg, right? There is a band. It's been tied, and there is a stick which goes in. Okay, now when you rotate the stick, okay, the tightness of the band can be controlled. How much tight? Okay, so that the distal pulse is not felt that much tight. That is the correct tightness, so that there is less bleed. And the bleeding should be reducing, it should be stopping, and you will not get any pulse in the distal end. It is better to have a gangrene than having a dead patient. Okay, if it is a severe bleed, it can kill your patient. So it is better to have a gangrene and amputation than having a dead patient. So in this particular case, you can apply a tourniquet. Chandramohan sir, I'm audible, right?
Yes, ma'am.
Okay.
Clear, ma'am.
Yes, madam. Yes, madam.
Okay, we are going to session 2, which is scene safety and primary assessment. So what are the objectives? We need to understand what is the importance of personal safety as well as the safety of the patient. We should take care that no further damage is done, including your infection control, because it is in COVID. We have to talk about our infection control as well. So we have to prevent any further damage, right? Using others to ensure that the scene is safe. Sometimes one person can't do it. If you have help, if you have people around, use them properly and to perform a primary assessment. So this is a picture which I wanted to show you. Okay, you have say you have gone hiking and you see this. What all do you see here? Can someone reply? I have 78 participants as of now. Can someone reply?
One has raised hand, ma'am.
Yes, yes, please.
Mr. Shantanu Malik, you can unmute yourself.
Okay. Thank
Yeah,
you,
sir.
ma'am.
Yeah.
Before this slide, I want to ask that is how long we can use the tourniquet, like 1 hour or half an hour.
No.
How long we can
So it
tourniquet up to reach the hospital?
okay, as soon as possible. Okay, you should take the patient to a primary health center or anywhere there is a medical help as soon as possible. You can use it till the time you need to control the bleeding. So the moment you take the tourniquet out, he is going to bleed out. It's not like a small wound. If there is a artery which is being nicked, that's not a small wound. It will kill the patient. Okay. So you need to keep that on till the time you reach a medical place where the bleeding can be controlled with other means, right? So about this scene safety, do you have anything to tell?
This is, ma'am, electric shock.
Electric shock, are you sure? It's not a person who has gone to Gujarat Night Fest and slept off? So what all do you see? Anyone?
Couple of them also have given electric shock in the chat box, ma'am.
Yes, it is an electric shock, but more than electric shock, what I wanted you all to notice from this particular scene is a live wire. The lady is in water, and there is bushy area around, which might be harboring a snake, for all you know, right? So if you want to approach this particular patient, how would you do that? First, we have to take care of this live wire, isn't it? Either you take the live wire out with a wooden stick, or better call the KSCB and tell them to switch off, or your electrical board and ask them to switch off this particular line. Okay, but you should never approach the patient and touch the patient with the live wire on. Okay, so you take the live wire off. Make sure that you have to shift the patient to a much more better place, okay, where there is no water and there is no bushes or any imminent dangers to the patient. Okay, so that becomes a scene safety not only for the patient but for you also. Okay, first I'm going to take care of myself and then I'm going to take care of the victim. I should not do any harm, isn't it? So my safety is the first priority. Second is the victim's safety. So I am going to take out this live wire because if I don't, then it is going to give me a shock. Okay, I have to pull her out of the water and make sure that the surrounding area is fine. So that is the importance of scene safety. Now, this is two scenarios. This is abroad, okay? I think it is in UK, and this is our own, very much on India. Okay, here you can see the victim. You can see the traffic being blocked. Okay, the police cars are here. This is the car. This is the car which have collided. Two cars. You see there is no other traffic around. Okay, it's been blocked off, so that you don't get into a situation where you meet with another accident in traffic. Okay, meanwhile our India, see this, there is a accident here, the lady is here. Okay, there is actual traffic there running this side. Okay, but a very good lady who's taking a photo of the scenario. Okay, instead of trying and helping the victim, we have people looking around. We have people pulling on her, and very interestingly, we see this person. Okay, I'm pretty sure all the youngsters who ride a bike would do this. Okay, not necessarily when there is an accident, but definitely when there is a good looking girls going around. So this one, he's worn a helmet and everything, but he is looking back at the scene and he's not concentrating on his own driving skills, right? Which can cause another accident. Okay, so this is the difference. So scene safety is going to be very, very important. If you find an accident, make sure that you block the traffic first, even before you yourself go to the victim. Okay, there was an accident in Bangalore where there was a bike accident. The fellow was thrown out and he was in severe condition. There was an auto guy who did nothing wrong. He just stopped the auto and went to help this bike guy and got hit by another bus. So that is a real life scenario. What happens in India, right? So whenever you come across any accidents, make sure that you block the traffic first, okay, even before you check on the victim, okay? Otherwise, it can have further accidents or further fatalities. So now, do not start resuscitation before securing the area. Always make sure that your patient and yourself is safe, okay? In COVID condition, before covering the patient's face, the patient's face has to be covered, so is your face to be covered. Okay, do not start resuscitation in middle of a traffic. Stop the traffic and then help the patient. Do not apply tourniquet on a snake bite victim. I already explained why. Do not touch any pesticide stained areas with bare hands because it can affect you at the end of the day. And do not ignore any fire hazards.
Ma'am,
yes?
Ma'am, can I ask you one question?
Yes,
That is,
please.
what will be the distance between if it is two-way road or one-way road?
Huh.
So I know that is something is like that. So on car or on track, distance should be between the accident and that. It is
It would
true,
be
ma'am?
ideal if you can leave more than that. It would be ideal if you can leave,
Okay.
the furthest you can stop them, the better. I wouldn't give you any specific length because that is not something which is evidence based, right? But if you, I don't, I hope you are a driver, right? So if you have driven a car or a bus in a highway when you are going at around 100 plus kilometers per hour, it's very difficult for you to give a sudden break. Okay, so I would say as much further away from the patient as possible. Okay, and then how do you stop the car also? How do you stop the traffic? Often you can use the vehicle that you are in, or the red signals which comes along with the vehicle. Have you seen that, the red reflectors? You can pop that up. Okay, there's so many ways of doing it, but you have to make sure that you yourself and the victim is safe. All right, can I go forward?
Yes, ma'am.
Yes, yeah. Sure. So next one is your primary assessment. What are you going to do once you see a victim and you made sure that the scene is safe? You're going to do a primary assessment. Okay. One, assess the conscious level of the patient. See if the patient is conscious or no. Okay. So assessing conscious level, it has 4 components to it. AVPU we call it. Okay, one is your alert. If you see if the patient is alert, he is awake or no. Second is that you give a verbal stimuli and you get a response from the patient, whether you are going to check if the patient is responding to a verbal stimuli or no. So you call out the name. Okay, often hitting on the clavicle here. Okay, sir, are you okay? Okay, so that way your voice have to be loud, clear and crisp, okay, when you're calling, right? So that becomes a verbal stimuli. So now the verbal stimuli is also not producing any particular response. What do you do next? You give a painful stimuli, isn't it? We physios love painful stimuli, isn't it? So often we used to rub on the sternum or prick here to see if there is any response to a painful stimuli. The best way for you to check for painful stimuli is going to be a trapezius pinch. Sorry, not punch. So that is, you pick up the patient's trapezius this way and pinch. Okay, give a nice good pinch. So that produces a very good amount of pain to which the patient will respond. Plus it gives you a dignified method of giving a painful stimuli. Say if the victim's family is around, okay, a guy is collapsed and his wife and kids are there, would it look good to go and hit on his sternum or poke in his eye? No, right? This one, it's very discreet. It's very discreet. No one will come to know what you're doing unless and until it is a medical person who's observing you. So this one, the trapezius pinch, is going to be the best thing. It doesn't leave any bruises also, so that you are also safe. If to that also the patient is not responding, then you can tell that the patient is unresponsive. So 4 things: A, V, P, U. Check if the patient is alert, if the patient is giving any response to verbal stimuli, if the patient is giving any response to painful stimuli. At the end, you say that the patient is unresponsive. Okay, now if unresponsive, what do you do? Okay, make sure that the patient's face is covered, because right now we don't know who is COVID positive and who is COVID negative. 80% of the symptoms is thought, patients are thought to be asymptomatic. So in which case we really don't know if the person who's the victim, who needs your help, is COVID positive or no. The best way to approach such a patient is to assume that he is COVID positive. Okay, cover his mouth as well as your mouth. Okay, normally JeevaRaksha used to call it LLF. Okay, look, listen and feel, where you are looking for the chest raise. Okay, you are listening to the breath and feeling the carotid pulse. Now, seeing the COVID situation, we have made it cover, look, and feel. Okay. So if it is a LLF, you can see this fellow who is safe, right? He would bend over near to the person's face and listen to the breath. At the same time, look at the chest, if the chest is raising or no, and feel for the pulse. It should not take more than 10 seconds to assess this. Okay, so that was a normal method. Now, because of the COVID era, we have changed it. We have to see our safety also, isn't it? So we are going to cover the person's mouth. We are going to put our mask also, and we are not going to go near the patient. Okay, if you see the person who is checking here, he is at 1 arm distance from the patient. Okay, he is checking the carotid pulse, plus he is checking for the chest raise also. I hope all of you know how to check for carotid pulse. This is the trachea, right? Move laterally, you will find the valley. okay, between your trachea and the sternocleidomastoid. Go up 2 centimeters or so, you'll find the carotid pulse. Can all of you just check your carotid pulse, please? Participants? Did all get? Check. Shantanu Malik, check your carotid pulse, ma. Good.
Ma'am, how long I can compress that?
Sorry?
How long I can compress that pulse?
You're not going to compress it, you're just going to feel it. If you compress, then that will be a problem. You're just going to feel it. It should, that's what I told. The primary assessment, that is you're covering, look and feel. All those three things should be over within 10 seconds. Okay? Got it? Whoever asked the question, did you get it? In 10 seconds time, you should be able to locate the carotid pulse, look at the chest raise, and know whether the person is breathing or no, and whether he is having a pulse or no. Okay, I hope I have made myself clear.
Yeah, ma'am. Yes was the comment in the chat box, ma'am. So
Yes.
that,
Okay, fine. Okay, now if there is no response, I mean, if there is, you have checked your AVPU, as well as you have covered, look and felt the pulse, there is no pulse, there is no chest rise, then we say that the person is having a cardiac arrest and call for help. What is the toll-free number for help here? 108. Okay, you call for help immediately. Or you call out to people, you can gather people around, okay, ask them to call the helpline. There is no problem. But if you're the person who's talking to the call line should give where exactly is the position of the patient, that is where exactly is he, give the landmarks and tell what is the condition that we are not able to make the patient is unresponsive. Often it will be in layman terms. Okay. So if you just look at the summary, we talked about scene safety, primary assessment, assess consciousness, AVPU, cover, look, feel, chest raise, the breathing and the carotid pulse we have already checked out. And we conclude if there is no pulse and if there is no chest raise, we conclude that the person is under cardiac arrest. Okay. Now, session 3 is going to be a cardiac arrest session. What is it? We are going to understand what is a cardiac arrest. We are going to talk about the importance of calling for help, learn the correct steps to follow in such a situation, right? Cardiac arrest, if there is no effective, if there is no effective chest movement, no pulse, and the patient is unconscious, we are going to rule that it is a cardiac arrest. Okay, I repeat, if there is no chest movement, if there is no pulse and the patient is unconscious, then we are going to say it is a cardiac arrest. What do? Once you check for CLF, okay, you do the look, feel and cover part of it, and you don't get any pulse or the chest movement, you're going to conclude that it is a cardiac arrest. As soon as you conclude that it is a cardiac arrest, ask for help. Either call 108 or shout out help, so then someone else will come and help you out. Okay, so whoever calls, I told you, you have to give your exact position and how the patient is. Okay, they would give you a estimated time of arrival as well. As soon as you call for help, start CPR. As fast as possible, get hold of a defib. And as soon as possible, transport safely to the hospital. Okay, so these are the things that you're going to do if we know that the patient is in cardiac arrest. We'll come to each one of it. Now, cardiac resuscitation. There are two important components to cardiac resuscitation. One is effective compression and two is early use of defib. So these two components have been shown to actually increase the survival rate of the victim to a great extent, right? Now, chest compressions. For the chest compression to be effective, the patient should be on a flat surface so that the if you have a spongy surface and you have hot air and you're going to compress, it doesn't compress fully. Okay, it doesn't because the soft surface or the mattress will go down along with your compression. So the heart doesn't compress fully. The chest, the thorax doesn't compress fully. So you need to have a flat surface. In hospitals, you will be having the cardiac slide or board, okay, onto which we can put the patient in and then start the CPR. The persons, normally AHA or any other CPR course that you could have come across, could have given you 5 centimeters or 2 inches. Now, the problem with that is, if I am going to give a chest compression to a top model, okay, who is very thin, then maybe it will work. But to a person who is overweight, all thanks to our sedentary lifestyle, almost 60 to 70% of people are overweight. So if you go and try to compress 2 inches on an overweight person, it will nearly actually compress the subcutaneous fat, subcutaneous fat. Okay, not the heart or the thorax. It will not have any effect. So what we are looking at is, if this is the anterior posterior diameter, 1/3 of that should be the compression. Okay, so this much. So if you take your anterior posterior diameter and then you check for the compression. Okay, so 1/3 of the height of the chest wall. You should recoil slowly. So what happens when you are in an emergency situation? There is lots of adrenaline which is going on. You are never going to slow. Okay, you're never going to go slow, but instead you will probably work more. Okay, which gives a heart rate of 160, 180 and all. So what happens is, the thorax has to fully compress and fully recoil to the full length, the height of the body. Okay, compress and fully recoil. There are two physiological things which are happening. One is called as a cardiac pump. One is called as a respiratory pump. When you're giving a chest compression, so the hand, which is on the lower 1/3 of the sternum, it's going to compress. Okay, when 1/3 of the height of the body is compressed, the heart is getting compressed. Okay, effectively the ventricles are getting compressed, which throws the blood out into the body and then to the organs. Okay, now if you don't recoil fully, there is no returning, that is the venous returning will not be there. So ineffective amount of blood will be there in your heart for your next compression to pump out. Okay, that is the importance of this recoil. You have to allow a full recoil. That is your cardiac pump. Now the respiratory pump, when you are going to do 1/3 compression, it is not only your heart is going to get compressed, lungs is also going to get compressed. Na? Lungs is not going to say, okay, I'm not the one who is responsible, I'm not going to do anything. No, even that is in the thoracic cavity. So even that is also going to get compressed. 1/3 of the lungs is going to get compressed, which throws the air out. And when the recoiling happens, air is sucked in. So both the pumps are going to work in this particular situation. So slow recoil is very, very important. Okay. You give the compressions continuously for 2 minutes. At the end of 2 minutes, you do a primary assessment, that is CLF. Okay, covering is already done. You look, feel and look for the chest rise. It should be done in less than 10 seconds. Okay, reassessment should not take more than 10 seconds, because the moment you cross more than 10 seconds, the circulation that you have already established is going to go down. Okay, so that so don't do a reassessment for more than 10 seconds. Make sure that you finish the reassessment fast within 10 seconds and restart the CPR if there is no pulse felt. Okay, 1 minute. So effective chest compressions, firm flat surface should be there. 1/3 of the height of the chest wall should be compressed. Slow recoiling should be there, continuous for 2 minutes, and reassess after every 2 minutes. Okay. Now, compressions can be stopped in 4 situations. One, after every 2 minutes to reassess, right? Then only we'll get a proper pulse from the patient. So if you're doing the compression and you do the reassessment, okay, if you don't stop CPR during reassessment, you will get a carotid pulse. Okay, so make sure you don't do that blunder. You stop the CPR and then only you do a reassessment. Okay, but as I told earlier, within 10 seconds, you should be able to reassess the patient and restart CPR if needed. Second situation where you stop CPR is when the defib is actually assessing the rhythm. Okay, so the AED, I'll come to it in detail. When the AED is actually assessing the rhythm, then you stop CPR. Otherwise, what will happen is your hand has electrical impulses, isn't it? So your hand impulses will be picked up by the AED and misread it as a impulse from the heart, okay, which can actually it can mislead the AED, telling that okay, no need of shock because pulse is all, electric activity is already there. So don't touch the patient when the AED is assessing. Okay, you stop CPR when the AED is assessing. When shock is delivered by the defib, if you keep on giving defib, CPR during defib and give the shock also, soon you will need a CPR. Okay, so you don't give CPR when the shock is being delivered by the defib. Fourth situation is when the patient is awake and he pushes you away. Okay, so that is the 4 situations, only 4 situations when you're supposed to stop your CPR. Okay, after every 2 minutes to reassess the patient, when the defib is actually looking for the rhythm. Third one is when the defib is delivering the shock, and the fourth one is if the patient pushes you away. Now, for adults, face should be covered. Always remember, it's COVID. Face should be covered of both the victim as well as you. Okay. The compressions should be 100 per minute, 100 compressions per minute, continuously given for 2 minutes. Heel of the dominant hand, how do you do? Okay, I'll just put on the video so that I can see if all of you are doing it. I requested for the video. None of you have actually switched on the video. Can you guys switch on the video, please? Lots of familiar faces. Switch on your videos, please. Ah, that's wonderful. At least I can see Parul and Renita. Renita, hi. So what you're going to do is you keep your dominant hand out. Even though I write with right hand, but I am actually a lefty. So put your dominant hand out, the other hand over to reinforce the grip. Okay. So this is going to be your method of holding. Shantini Malik, do that. Put your hands out. Dominant hand out. Renita, come on. Dominant hand out. The other hand reinforcing. Okay. Now this part is where you're going to put it on the lower 1/3 of the sternum. Okay. How do you know the sternum? How do you palpate for sternum? Lower 1/3 of sternum. How do you palpate? Either you can come from down or from up. Okay. Get your cyphozoid. 2 fingers above that, you keep your heel. Okay, heel of the hand reinforced by your other hand. Okay, now the wrist, the elbow, and your shoulder should be in straight line. Okay, this way. It should not go like this. No. Okay. The elbow should be straight. Your shoulders rolled out. Your wrist should also be straight. Now, all these three things should actually come across or in line with the midline of the patient, and extend your back. Okay, so that you are not using your shoulders, neither your upper limb muscles to create the energy needed for the compression, but your core muscles are being engaged. Okay, I'll just show you. Okay, you can see this particular person. He's kneeling down. This is a CPR mannequin. This is the way you will be getting trained if you are coming to JeevaRaksha for a training. Okay, so you can see the person is kneeling down. His knees are parallel to the patient's thorax. Okay, little away. Okay, knee and hip in a straight line. Okay, from there his back is extended slightly. Okay, you can see because of the shirt it's not that visible, but the back is extended. The shoulder, elbow, and the wrist should be in straight line, which is in line with the midline of the patient. Okay, so am I clear with the position of the person's delivering CPR? Yes? Yes or no? I'm taking it to be yes. Okay, so
Ma'am,
yes.
position of the therapist or person is little bit far in right side. It should be in left side.
No, there is no sides. It can be in left or it can be in right. There is no problem. Okay, you can stand on right, you can stand on left. It is totally your preference. There is no issues with that. We are not giving any particular side, because when there are two people, two rescuers, you will use both the sides. Okay, so there isn't any problem in standing right or left. No, because we are not keeping the hand on the left side of the chest. We are going to keep it on the midline, on the lower 1/3 of the sternum. Okay, so that there isn't any issues. Fine. Is this position clear to you? Both the knees parallel to the person's thorax, knee and hip in a straight line, back extended. Okay, lower back is extended, shoulders rolled out, elbow straight, and the wrist is stabilized. Okay, wrist, elbow, and shoulder will be in a straight line, which is in line with the midline of the patient, so that you can generate the compression force from your core muscles and not your upper limb muscles. Okay, upper limb muscles are small. Remember that. Remember your biomechanics. Upper limb muscles are very small. It will get tired. Okay, there are instances that CPR had to be continuously given for 30 minutes, 40 minutes. Okay, so don't use your muscles which are going to get tired fast. Instead, use your big muscles, okay, which are your core muscles. Use the core energy, not your hand energy. Okay, so this is the position that you're going to deliver. Now, how do you make sure that you're delivering 100 compressions per minute? I told you 100 compressions in a minute, isn't it? How do you make sure? This way. See, now even he will do. Okay, that beat. That is exactly 100 beats. See the way he is doing. Okay, now enough of looking at Malika. We'll come back to our topic. Okay, so that is the way you make sure that you are giving 100 compressions per minute. Chaya Chaya seems to be a very familiar song across India, something which speaks to the heart of Indians. Thanks Shah Rukh or Malika for that. And it delivers 100 beats per minute. Any doubt? It's exactly 98 beats per minute. So you can keep the song Chaya Chaya in your mind. Please don't sing it out. Okay, it will be a serious situation. Don't sing Chaya Chaya there. So go according to that rhythm. And it is 98 beats per minute. It will be around 100 beats per minute. Okay, so that is a very easy way of keeping in track. Otherwise, what happens if you go more than 120 20 plus, the recoil will not happen. If there is no recoil, there is no venous return. If there is no venous return, there is no cardiac output. Okay, so everything is of no use. Okay, so your the frequency is very, very important. Now, compressions in child, face should be covered. Compressions should be somewhere around 120. Fast forward chaya just once. Okay, FX1, that will be a little more faster. Okay, again 1/3 of the height of the chest wall to be compressed. Now, if the patient is unconscious, if a pediatric patient is unconscious and has a heartbeat less than 60, start CPR. Okay. In adults, what did we do? We didn't get a pulse, then we started CPR. In pediatric case, if the patient is unconscious and less than 60 beats per minute, start CPR. Okay. Now, we'll come to AED. You could have, all of you could have seen this, I'm pretty sure. Okay, red color box in malls, movies, airports, everywhere you could have seen it. Cricket matches, concerts, everywhere you could have seen this, but no one knows how to use it. Okay, so yes,
Ma'am.
Yes,
Ma'am, for pediatric case, is it important to give to rescue breath at first?
Okay, so we are not talking about breath at all. Okay, because as I already explained to you, because everywhere else AHA gives 30 compressions and 2 breaths. So different Red Cross gives, I think, 15 compressions and 1 breath. So JeevaRaksha doesn't give a breath at all. Okay, breath is going to take a second seat, because as I told you, when you compress, not only your heart is getting compressed, your thorax, the whole thorax is getting compressed, so your lungs are also getting compressed to 1/3 of its total height. That is 33% of your lungs is actually working. And how much, if you can survive in Bangalore with such a low amount of oxygen in the air, 33% of lungs is enough and more. Okay, so we are not talking about any ventilation at all. We don't give ventilation any importance unless and until you have a person who can be spared and there happens to be a good ambu bag around. We don't talk about ventilation at all. Now, that is the normal scenario. Okay, once we come into the COVID scenario, what happens? Anything with breath, okay, is a aerosol producing procedure. Okay, ambu bag, you're going to press, it is going to create aerosols, which puts all the people around him in danger. Okay, whether it is a baby or it is an adult, we are never talking about ABP, ambu bag or ventilation at all. Okay, so we need the heart to keep working and the passive air, the breathing to be happening. Okay, we need the circulations to keep happening so that all the vital organs get the circulation well. Understood? So we are not talking about any breath at all. Got it? Especially in COVID, don't go behind breath. We don't know whether the patient is COVID positive or negative. We have no idea about what their medical condition is. Anything to do with breath is going to create aerosol particles, which can cause you to have a COVID again. Okay, that is the importance here. Understood? Can I go forward? Okay, so now AED. You could have seen AED something like this. Okay, a small machine. It has the pad here, okay, along, it has the pad here along with the lead wire. Now, AED is like you have a MD cardiologist sitting inside that machine, okay? He can actually see your ECG, check you whether you are ventricular, having a arrhythmia or there is no beating at all, what is it, okay? And advise you to actually shock the patient or no, okay? So AED is a very important device. Make sure that anywhere that you go, the malls that you're going to frequent, the movies that you're going to frequent, make sure that you know where the AED is so that you can take it and use it. Okay, so one time something happened and I asked for the AED to the people, even in hospital, AED was not available. Like the manager had already put the AED in a very good cupboard, locked it, taken the key off with him, so the AED was not available. Okay, only for inspection they'll keep the AED. It should not be like that. AED can be used even by a layman. Okay, we are training actually anyone who can understand what we are talking about. So that is 12th plus. Okay, anyone. We have given the training in corporates where they didn't have any idea about what we are talking about in medical terms, but they were trained in AED as well. Okay, so make sure that you know where the AED is. If it is your college, if it is any place that you're going to go constantly. Today we have a pilot with us in the audience, so Amu, please make sure that you know where the AED is in airports so that you can use it whenever it's needed. So it has a pad. The pad will very clearly tell you where to be kept. Okay, if it is adult, then you can keep the pad on one pad on the left clavicle just below it, and one pad on the side of the thorax. Okay, so that the heart comes right in between. Okay, if it is a baby, you can keep one pad on the anterior chest, one on the posterior chest. Okay. Survival of the chances of survival of the victim if shocked early is very good. Every second or every minute that you are going to delay the defib usage, the chances of survival is going to go 10% down. Okay, so make sure that you give the defibrillation really as soon as possible. Now, this is how the most of the AEDs look like. Okay, you'll have the pad here, which is very well, it self-demonstrate where to be kept. Okay, in adult, it is on the, one on the right clavicle, just below the right clavicle, and one on the left thorax, mid-axillary line of left thorax. So that the patient, the pad will come across. I think last time I told left clavicle. No, it is right clavicle. Okay. Even though I showed it on my right side, I told left side. I'm really sorry for that. It's on the right clavicle, just below the right clavicle, and across on the mid-axillary line in the thorax cavity, so that the heart comes in between the two pads. Now with the cable, you have to, where did my arrow go? Okay. So with the cable, you have to attach it to the machine. Okay. Now, AD will advise you to press button if the patient is a child. Okay. A child button is there. If the patient is a child, you have to press that. Now, if you don't press it, it assumes that you are treating an adult. Okay. It assumes that it is treating an adult, and it will ask you to apply two pads on the corners of the chest, as I told you. Okay. Right clavicle, just below right clavicle, and the other one on the left mid-axillary line on the thorax. Okay, it should be fully, it's an adhesive tape, so it should be fully in contact with the skin. Now, when you are applying the skin, if you have someone else to apply it, let them apply it and you continue with the CPR, or give the CPR to the other person and you keep the pads. Okay, but the CPR should not be stopped. If you are the only one, then you can't really help it. You keep the pad first. Okay. Then you keep compressing till the time the machine actually tells that do not touch the patient, assessing heart rhythm. When that happens, you take your hands off. So we talked about when all to stop your CPR. That was when the defib, one of that situation was when the defibrillator is assessing the heart rhythm. So you take your hands off. Okay. Then it will tell, once the assessment is done, then it will tell shock advised charging. In that time, it takes some time for the defib to charge, depending on the manufacturer and the brands that brand is being used. It takes some time to charge the defibrillator. So during that time, you continue CPR. Okay. Now, once it says stay clear, charged. Okay. So till then you continue CPR. Once it say charged, ready for shock, you take off the hand. You being the team lead, make sure that no one touches the patient. So I am going to say, I clear, you clear, we all clear, shock. Okay, so I have to, the team lead is the person who is responsible for the safety of everyone, the patient, the person, people who are around you, the people who are helping you, as well as your safety. So I am going to say, as soon as the defect gives you that ready for shock, it is going to give you the command ready for shock. You are going to take the hands off. You stop the CPR, take the hands off, make sure no one is touching the patient. Say, I clear, you clear, we all clear, and then give the shock. Okay. As soon as the shock is given, you resume the CPR for 2 minutes. After 2 minutes, you reassess again to see if there is a pulse. Okay. I'm going to repeat this once more. If it is an adult patient, you keep the pad under the right clavicle and on the mid-axillary line on the left side thorax. Okay, you have to make sure that the pad is fully in contact with the thorax skin. And then while doing this, if you have a helper, keep doing the CPR. Don't stop the CPR. If you are the only rescuer, then you keep the defib first, and then you keep doing the CPR. When the machine tells you that it is assessing rhythm, take your hands off. You take the hands off. Okay. Once assessed, the the AED will tell you whether the person is shockable or not shockable. So if it says shockable, charging, you keep back on the CPR. Okay. This depends on the brand. So always listen to what the AED is telling you. Okay. You go back to the CPR. The charging happens, a little bit of delay will be there. Charging happens, and then the command comes like shock ready. Then you have to take the CPR hands off. Then you have to take your hands off. Make sure that no one is touching the patient. Give the command, I am clear, all of you clear, we all are clear, and then give the shock. After the shock, you resume your CPR for 2 minutes. After 2 minutes, you reassess. Okay, am I clear? I hope I am clear. Okay. Now, if it is a child, only difference is going to be where you keep the pad. Okay. Sorry. Only difference is going to be where you keep the pad. One pad on anterior surface of the chest, one pad on posterior surface of the chest. Okay. And baki everything remains the same. Okay. During assessing, take off your hand. After assessing, when it's getting charged, keep doing CPR. When it says shocking ready, take off your hand. Make sure no one is touching the patient. Give the command, I clear, you clear, we all clear, and then give the shock. Resume CPR, 2 minutes CPR, and then you do the pulse check. Okay, primary assessment again. I hope I am clear. If there is any doubts, we'll look at it at the end. Now, 1% CPR. First, you have to see that the scene is safe and do the infection control. That is the mask and your mask and everything should be taken care of. Assess the patient, that is AVPU, as well as your CLF. Okay. Cover, listen, look, and feel. Now there is no pulse, no responsiveness, no chest movements. Then we confirm that it is a cardiac arrest, and we call the helpline. Okay, 108. 108, and start the CPR at the same time. Give them the correct place and where you are located at, what is the condition of the patient. They'll give you estimated time of arrival. Till then you have to keep doing the CPR. So every 2 minutes, then you start singing Chaya Chaya. Okay, every 2 minutes you have to recheck. Okay, make sure that the frequency is correct, make sure that the recoiling is there. Okay, after that you have to recheck the assessment, and as soon as the AED is available, keep the AED and shock the patient. If there are 2 people, then it becomes little easier. Person 1 or the person who have a bit of medical background would be the team lead. Okay, the person team lead is responsible for scene safety. I keep stressing on this. The person who takes the lead is responsible for everyone's safety. The team lead safety, the patient safety, and the people around ka safety. Okay, so person 1 is going to do the scene safety, ensures infection control, ensures that there is mask, and assess the person and start CPR, and give the command to the second person to call for help. Now, the second person calls for help, give the correct details very clearly and crisply, and come back and take the hovering position. Because one person to give CPR, it's very demanding, it's very very tiring. Okay, if there is a second person, then please take their help. There is no problem in that. You alone can't save a patient. Okay, so if the second person is there, he comes back to the hovering technique. If he is a person who knows to give CPR, then you tell, okay, you can take over the CPR. I'm counting down. Okay, so with each compression, 5, 5, 4, 3, 2, 1, I take my hand off and he keeps it. Okay, and he continues the compressions. So this compression can be changed between the two people as much as needed on proper command. Main thing is the counting down is very, very important so that you don't miss a beat. Okay, and every 2 minutes you have to swap. If there is 2 people, every 2 minutes you can actually take CPR in rounds. Okay, and then the assessment should be taken by the person who has a medical background. So it would be the team lead. Okay, so every 2 minutes you're going to do the assessment and then swap. Okay, make sure that all of you all, that is the rescuers as well as the victim, has the face covered. Any questions? I think at last we'll take questions. Okay, now session 4, choking. So at the end of the session, we should be able to recognize a person who's choking, should be able to demonstrate proper techniques in all age groups, as well as help yourself if you are choking and no one else is there to help you. Okay, so this is called as the universal sign of choking. Your hands will come up to the neck and they'll try to take it out. Okay, eyes will be bulging, tongue might be out, and hands will definitely be here and they'll be bent over. Okay, so that is called as the universal sign of choking. Now, difficulty in breathing due to airway obstruction is called as choking, and common in all stages of your life. Okay, from child to old people, anyone can have this. It's one of the most commonly come across emergencies. Okay, so fourth leading cause of unintentional death in USA. So you can think about it. Okay, more than 60% of all the choking is somehow related to your food. Popcorns, lollipops, candies, mutton pieces, all these things are very notorious, which can cause choking in people. Okay, if the patient is going to, so what happens is, you see a person who was perfectly all right, walking, talking, having fun, die in front of you in 3 minutes, under 3 minutes. Okay, so that is a very, very difficult situation. The patient will become unconscious in seconds in front of your own eyes. Okay, so it's a very difficult place to be in, both for the victim as well as for the rescuer. Okay, and if they become unconscious, they will have or develop cardiac arrest. Okay, so we have 2 types of choking kits, I mean adults. One is conscious choking people. If the person is conscious and if the patient is coughing, trying to cough out, then what you do is you come into straight stance, okay, on the side of the patient, as seen by this. This is a patient and this is the therapist, say the rescuer. So she's on the side. You keep your hands in front, pull the patient over or bend the patient over and give slaps, okay, back blows right in between, that is your intrascapular area. You give nice good chest back blows, okay, 5 back blows. They should be able to throw it out, okay, if the patient is actually awake. So I'll just see if I can show you the technique. I have my husband here to help me. Okay, so this is my husband. I'm sorry, your face is not steady. Okay, this is my husband, Mr. Sanoj. He's very well interested in helping save people's life. So we are going to demonstrate how this should be done. Okay, hands across. So he's choking. I'm going to stand stride length. Okay, one leg's just in front. Put him over my hand and give back close this way. Okay, it would help him to throw out the. Thank you so much. It would help him throw out the obstruction. Okay, if the patient is unable to cough, then means the obstruction is very severe. Then you use the abdominal thrust or Heimlich's maneuver. Okay, for this, what you do is you can you come again? You stand behind the
I'm
patient.
sorry to interrupt, ma'am. Ma'am?
Yes.
Can I stop screen
Yes,
sharing,
yes.
ma'am? Can I stop screen sharing, ma'am, so that your screen will be enlarged?
Speaker.
Okay, I'll stop it.
Yeah, ma'am. Then you can restart it, ma'am.
Now is it okay, Chandraman sir?
Yeah, ma'am. Yeah, ma'am.
Yeah. So what I'm going to do is, he's on the okay, he's having the universal thing, okay, universal sign of choking. I am going to keep my hand out, okay, thumb in, hands closed, so that there is a good prominence here. Okay, that I'm going to keep just above the umbilicus here and reinforce with this hand this way. Just watch it. Okay, so this one, thumb out, hands rolled just above his umbilicus, in between his umbilicus and his xephisternum, and the other hand across. Okay, he is to be standing wide and your leg will be stepped forward in between the leg. Okay, and so this way, fine, and I'm going to go inward and up. Okay, this, fine. No matter how big the patient is, if you do this correctly, you can aram se do it. Okay, 1 minute, I'll share the screen. Thank you, Sanoj. Okay, so you are standing behind the patient. The patient is keeping the leg little wide. Okay, you keep one leg in between both the legs, the other leg little back. Okay, so you can put the weight behind. There is no chances of you falling. If you come and stand just like that, right behind the patient, and if you don't have the proper anchoring, when you lift the patient inside and up, right, when you lift the patient, there are chances that both of you fall back. Okay, so don't do that. You can make the person stand wide, or one leg will be forward, the other leg will be back, so that there is good anchoring. Hands out, thumb inside, roll over, the other hand is going to reinforce it. Okay, inside and up, this way. Okay, this way, fine. You give nice good forceful jerks inwards and backwards. Okay, so that the person takes the choking food out. Now, what if the person is having very big frame, or then you keep the hand just over the tummy. Okay, just on the just under the staphyzoid process. Okay, if it is a small kid, then the correct position, small kid in a sense, not a toddler, a kid of 7 to 10 years of age, then you can, okay, what is happening? Okay, then you can kneel behind them like this and do the same. Okay, because with kids it's very common to get a choking kid around you, so make sure that you know how to do it. Okay, in very tall person, you can either make the person to sit on a chair and you can kneel down and do the same, or you can ask the person to make them sit on the floor and legs stretch forward. You can do the same thing. Okay, but chances of that is very rare. If you do the actual Heimlich technique in the proper way, if you anchor yourself well, no matter how big the person is, we can actually give a good thrust. Okay, and even if the rescuer is very thin and not capable to do it, also you can produce enough mechanical advantage from the way you are arranging yourself behind the patient. Okay. Now, if the patient is unconscious fully, how is this? Dr. Chandramohan sir, is anyone else assessing my slide?
No, ma'am.
Sure.
Yeah, ma'am. You can stop share and reshare it again, ma'am.
Just reshare. Stop sharing and reshare.
Okay. Now is it okay? All right. Now I think it's okay. So if the patient is unconscious, yeah, the perks of doing a webinar from home. I'm really sorry for this. Okay. All right. So if the person is unconscious, then please call for help and dial 108 and tell the people, give them the exact address where to find you. Place the person flat on the floor and CPR. Okay, start CPR as soon as the person goes unconscious. Okay, so so the CPR frequencies, the CPR protocol to be followed here also if the patient is the patient is actually unconscious. Okay. So as I told you earlier, also it can produce a cardiac arrest within seconds. So make sure that you start the CPR as soon as possible. Now, so what happens is when you give the CPR and you have a cardiac arrest, the spasms actually relieve. Okay, and with the compression, the food particle might come into your mouth. If make sure that the mouth covering is there. If you're able to actually see it, then you can go forward and remove it if you know that the person is not having COVID positive. Okay, if you know that the person is not COVID positive, that is, say if it is my husband and I'm 100% sure that there is nothing wrong with him, then I can go forward and do it. But on a stranger, don't bother about the food. It will come out into the mouth anyway when you're giving a CPR. Okay, and when the patient comes back into consciousness, they'll cough it out. Okay, don't go and create or swipe it or anything. Don't especially try to remove the food particle, because you might be pushing it down further. Now, so if the patient is choking and then goes unconscious, call for help and restart. Start your CPR. Okay. Now, what happens if you're alone? Okay, no one around. You were nicely eating a mutton biryani on a Friday night. No one around, and then you choke. What happens? If you're able to cough, okay, then lean forward and cough out as much as possible. If you're not able to cough, then as the person have shown here, okay, lean over the back of a chair and produce the thrust that another person would produce on a Heimlich maneuver, the same way you produce the thrust through the furniture. Okay, so that till the time the bolus comes out. Now, choking in infants, one of the most common things seen during the infant period of time, one which is very, very devastating. I have come across a couple of people whom have gone through this. Okay, so if there is a choking infant with you, I have a rag doll with me. I would show you this. Okay, then you're going to position the
Madam,
baby.
please go off screen, madam. Sorry to interrupt you.
Okay. Sorry.
That is for the YouTube viewers.
Yeah, this one, is that okay? Sit.
Yeah, ma'am.
Yes, madam.
Sit. You should be, I'll go further back. Okay. You should be sitting with one leg in front of you, the other one bent. Okay. The baby should be in gravity position. See the way I'm going to get hold of the baby. Okay. Nose and mouth is here. My 2 fingers are here. Okay. And slightly extend the baby's head. Slight extension. Okay. So I'm going to sit like this. Give 5 back flows. Okay, once 5 back flows are over, you turn the kid this way and check if it has come out. If still it is she is choking, then keep your hands this way, okay, perpendicular to the chest, and give 5 compressions. Fine. Still nothing. Put the baby back and give 5 blows. Okay. Still, you turn the baby. Look for any changes. If nothing, again compression. I hope I have made it clear. The way you keep your leg is very, very important because it puts the baby into gravity assisted position. Okay. So this way, put the baby's head a little into extension and then give back flows. Turn and look if there is any difference. If nothing, then you go forward with the chest compression. 2 fingers perpendicular to the baby's chest and then compress 1/3 of the chest height. If the baby becomes unconscious, then start giving only CPRs. Chest compression techniques in babies, either it can be done through this way, okay, or it can be done with 2 fingers, 2 hands, so that the chest, it should be in the midline, midpoint of 2 nipples, okay. You can see here. Okay. 2 nipples, midpoint of that on the sternum, okay. Your thumb would be here and then compress, okay. Otherwise, if you're going the other way around, you can give this. Make sure that 1/3 of the height of the chest is being compressed. Okay. Now, you are in a party and a woman shouts, "Help, help, my baby is dying." And you see this. See, something is there in the mouth and the baby is struggling to breathe. What do? You ask the friend to get the car ready to take the baby to the hospital and immediately do which of the following? We start with this one. I think Chandramohan sir, next is all questions. 10 questions I have put. Okay, so you can give it to them.
Yes, madam. You can ask participants to answer.
Yeah.
And
so
is the session over, madam? Is the only question answer time now?
Now it's only question answers, yes.
So session is over.
Yes, yes. The session is over.
Okay, I have a surprise for you. Even I am surprised. Okay. And may I call upon the youngest Indian physiotherapist student, Dr. Ali Inani sir, please come on camp.
Oh my God. Hi, sir. Good evening, sir. How are you?
Hi, good evening. You are great. I was listening from start. Too good, too good, too good. I wish you could go to all the colleges. I wish you could go to all the colleges and teach our physiotherapy students.
Definitely, definitely, sir.
How to save lives. I'm so happy that Chandramohan has covered CPR also. And it happened when I was speaking last week. I just told him CPR should be taken, and he mentioned your name. You will be coming. I said I need to watch.
I really didn't know that you're watching. Had I known, I could have been really tensed, I guess.
Yes.
I know, madam. You might get tense, but yeah. Sir is a really, how to say, learner. Even at this age, he wants to learn, and he also advises all to learn. Age doesn't matter.
It does not stop. You learn new things. I knew, but I did learn something different from you. So I was following it what I used to do and what you were doing. It was plus something more.
Thank you so much, sir. Happy to.
Especially the choking part. Choking was very interesting. Very interesting. Yes.
Something that has happened to me also. My nephew actually choked on candy. He was running around with a candy in the mouth. It was before, it was when I was pregnant with my son. So, it was a very tense moment and I managed to take it out. But, that's some time that, you need to share all these things with anyone and
Yes.
everyone.
Yes. May God give you a healing hand. God bless you.
Thank you so much with
Praise
your
God.
blessings. Yes.
Always.
So
Thank
we
you.
do have this running as a program all over India also. We are actually in talk with the central government as well. So JeevaRaksha is going to take over the BLS course training in India. So our aim is to actually provide training to anyone, all the laymen. So we had conducted one in my husband's company because one of the fellow engineer passed away because of a cardiac arrest and they couldn't revive him. So soon after that, there was a training program conducted for 25 of the
Are you all
engineers
based
who had actually been
Bangalore based or?
I am Bangalore based. The JeevaRaksha course is Rajiv Gandhi University, University of Utah, and Sri Vivekananda Youth Movement collaborative this thing. So we are happy to travel across India and teach anyone.
Definitely. I'll take the number from Chandra Mohan and we'll see that you are in Mumbai also.
Definitely, sir. My
Great.
what do I say? I'm so
We have 80 postgraduate students and almost 6 PhD students. So I want
definitely,
it
sir.
for them.
Definitely we'll do that.
I'll make it a point.
Yes,
Thank
sir.
you.
Thank you, sir.
All the
Thank you,
best.
sir.
Thank you,
Please
Dr.
stay
Chandra
with
Mohan.
us. Stay with us at the end of the session. I want you to wish all the physiotherapists the physiotherapy day. Just we will take another 3 to 5 minutes, hardly, sir.
Fine.
Please stay with us.
You want me to talk now?
No, sir. Stay with us. At the end of the session,
Okay.
the celebration
I'm
of
with you.
physiotherapy should start from your wish.
I'm with you. I'm with you.
Yeah,
I'll
yes,
come
sir.
back. I'll come back.
Yes, sir. Yes, sir. And question and answer session has started. Anybody have any questions? Please raise. Duna madam, Rupesh,
Yes.
please watch any questions in YouTube. Convey the question here.
Yes, sir.
Sir, no questions in YouTube yet.
Here in chat box, there were some questions.
Yes, sir. From Shantanu. For conscious patient, what is the importance of recovery position?
Sir, I'm not able to see the question. Where is it? I'm not able to hear you either.
For conscious patient, what is the importance of recovery position?
Recovery position.
Yes. What is the importance of recovery position? He is asking.
Is it during choking he's talking about?
Yes. It means the patient is conscious.
Yeah, when the person is choking and the patient is conscious, right?
Yes.
Yeah. Okay. So the moment you put him over and give slaps, he will try to take it out. Okay. So there is no forward going recovery position that we recommend. We recommend that as much as possible and as much as the time takes to take the choked bolus out, you keep giving the back blows if the patient is conscious.
Okay, madam.
Okay.
And
as soon as the obstruction is done, as the obstruction can cause a cardiac arrest within seconds, the patient can come back also within seconds.
And unmute Shantanu Malik. He says it is not for choking. Unmute him. Let him clarify the question.
Thank you, sir. For normal patient, when there is already you have mentioned that is conscious and unconscious. So if the patient is not choking, like only conscious, but they fall down or just that time they are cardiac arrest or anything.
So if it is a cardiac arrest, Shantanu, the patient will not be conscious.
No,
and if you don't get, yes.
Ma'am, not cardiac arrest, like patient are conscious, but they fall down due to accident or anything. So it is important to put the patient in recovery position because breathing is okay.
Breathing is okay if the patient is conscious, right? Only thing problem with him is that he fell down. Am I right, Shantanu?
Yes, he fall down. So semi-conscious or not getting your answer properly. So he's taking breath. So it is important to put the patient on the recovery position. Like during the RTA, road traffic accident, so many people are injured. So what we'll do during that time, because some patient will conscious and some patient during this ambulance will come. So in
Huh.
between that time, so
Hmm.
we put the patient in recovery position. That is very important.
See, recovery position, I have never come across something called as recovery position in emergency. Only thing is that, whatever the causes, the immediate cause of danger should be taken care of. If it is bleeding, it should be taken care of that way. If the person is not having pulse and no chest movements, you should start CPR. If the person is fine, conscious, you are getting verbal response from him, then absolutely no problem. If he wants, he can take rest, lie flat. It's up to the patient's this thing convenience, Shantanu.
Hope
Okay, ma'am.
you are convinced.
Thank you, ma'am.
Any questions you can raise.
No, no, sir. And
Okay.
I want to share something, just little word. That is, for internationally, those who are physios, when we go abroad for immigration, we can directly give physiotherapy or any situation like patient are unconscious or fell down. We can't do anything. But if we are uh, first aider, then we can. The world is yours. So it is easy way to treat the patient in the emergency situation. So every physio should learn this. It's very important.
Shantanu, something I have come across here for conscious patients, suggest them to cough continuously. So if there is no rescuer, I already spoke about continuous coughing. Okay, if what we are talking about is the patient is able to consciously cough, but he is not able to get it out. Then you put the patient forward and then slap, not slap, back blows. Okay.
Yes,
I
ma'am.
can say something, sir. I can wish ma'am from Bangladesh not for choking. Thank you so much, Shantanu. I take it as a compliment rather than an insult.
No, ma'am. That was
No, ma'am.
separate time, and this was at separate time, ma'am. Different times.
Okay.
No, no, ma'am. Ma'am, I'm used to connect with ExRx as a. We have a also platform, so maybe near future I will invite you because your lecture is so much. I think I have
Thank
learned a
you.
lot of
Thank
things
you so much.
because I have covered Sweden first aid in from Bangladesh, but there is 30:2. There is breathing procedure, but
Yeah,
now today I have learned
that is something
so
which
much
is
change.
being taken up by AHA 30 compressions to two ventilations. The reasons why we are not talking about ventilation also I have explained, I hope clearly.
Yes, ma'am.
Yeah, so this is even when they tell that it is 30 compressions and two breaths in UK, neither in US they stop compressions actually. The physicians, that the emergency physicians that we have in our team have been working in US and UK, and they have come across with this situation where people do tell that 30 compression into ventilation, but they don't stop it. So that is being carried on to our people. We have taken our statistics, we have taken our body mechanics into play, and then we have come across with this with evidence base. So there is no stopping of compressions at all, because each stop that you do, right, each time you take your hands off from CPR, the circulation is going to go down. If the circulation goes down, it takes 30 seconds to re-establish the circulation that we already had. So 30 seconds time is already wasted. That becomes too much of a heavy price to pay. So don't stop the compressions at all. Sayed Nawaz, who was my ex-student, and he will always remain my student, I guess. Should we do the head tilt and jaw thrust in CPR to open airways? Normally, Nawaz, yes, you can do, but in COVID times, we really don't know what is happening. We really don't know if the patient has a COVID situation or no. So we don't do that, what we call the chin lift manner. Instead, we just go forward with the CPR so that it will, anything which is obstructing also will come out.
Okay, ma'am. Thank you.
Okay, Gitanjali is asked, ma'am, if there is a rib fracture during CPR, how to take care of it? Gitanjali, it is better to have a person who has rib fracture alive than having a person who is dead but has rib fracture. So take care of your CPR first, the fracture can be stabilized once a patient gets medical help.
Okay, ma'am. Thank you, ma'am.
No problem. That's
Any other questions? Can we conclude?
Yes.
Ma'am, I have a question.
May I call upon Dr. Ali Rani, please?
Am I audible?
Yes, sir. Today is the last day of evening sessions from ExRxIndia.
Yeah.
And I never thought that you will be joining with us. As you requested on that day itself, I was like, I should send you the link. When I sent you the link, you said that I will try to join if I get the time. I thought that you are not going to come. But yes, I found you here. Then I was so happy that, okay, today is the last session for the evening session. Every day at 7 o'clock, we are boring many physiotherapists nowadays.
Wow.
Daily we are, but madam took it in other level. Okay, after a long time, your class got 100, and madam classes got 80 plus. Actually, it was so nice. Actually, we were like thinking that okay, we should stop boring the people now. And you two made us happy again. Though we are nearing end of our world record event. Sir, I would like you to wish all the physiotherapists in this live session, and so that everyone will start wishing each other globally World Physiotherapy Day. Please start, sir, so that we can follow you.
8th September usually are the World Physiotherapy Day, but I've been receiving wishes from all over the world on World Physiotherapy Day, and similarly, you have received many of them talking from all over the world.
Yes.
And I want to wish all the physiotherapists globally from anywhere. We have more than 7,000 in USA and Canada. I want to wish all the physiotherapists a very, very happy World Physiotherapy Day. The theme of this World Physiotherapy Day this year is pandemic, COVID-19. And as you know, tomorrow, all over India, there are camps, awareness programs, and lectures, webinars only on COVID-19. I'm taking 4 of them tomorrow, only talking about the role of physiotherapy in this COVID-19 and pandemic. I wish you, Chandra Mohan, all the best. And all the viewers today, a happy World Physiotherapy Day to all of you all. And may God give you all a healing hand. We are the healers. We heal. Thank you.
Thank you, sir. Thank you so much for joining with us. Now I request Dr. Rejisha also to wish all the physiotherapists and take this chance to wish everyone. And we will request Shankar sir if he is there, or Annie madam, and you all can start wishing. And so that we will also wish, then we will close the session.
Okay, thank you so much, sir, for giving me this wonderful platform. I have been working with Chandramohan sir, I think, for past 3 months or so since we started this webinar series. So my very good colleague, a wonderful person himself, Chandra Ganesh, have introduced me, and Chandramohan sir, I thank him a lot for giving, for thinking that I can carry on with the webinar at this point of time in my career into this larger scale. This is something which is going international. So initially, I did have a little bit of fear and insecurity, but the constant support the team has given me, my HOD, Ms. Dr. Annie, have given me, Shankar sir have given me, all of my colleagues have given me is beyond words. So I really thank each one of them. I thank my husband, who is being so spotty about the whole thing. He's taken care of the whole technical aspect of it from my end. He's today helped us also. He's taking care of my kids so that they don't come and disturb me in between this. So any girl who has a career in her life will know the importance of having a supportive husband and a family who supports your decision to go forward. Thank you so much, sir. Sanoj is also here. Thank you so much, Sanoj. So thank you all of you all because I have learned so much listening to the webinars. I've learned so much from my own students. Thank you so much for giving me this. I wish all of you a happy Physiotherapist Day tomorrow. Let us go to the forefront of this fight against COVID. Physios are really making a mark. In St. John's, we have started with the ICU ITU treatment, which me and Shankar Ganesh sir is leading, with 3 physios on rotation, and it's been wonderful learning experience for me. Please take this challenging opportunity to be a wonderful physio in your life. Thank you so much, my dear darling students, who have challenged me each and every step, asked me questions that I had to go back and read, refer, and come back and tell. Without you, I wouldn't be a good teacher. I thank all the EXRS team, Chandramohan sir, Juna ma'am, Rupesh, all of you all for being such a sporty, supportive team, and calling me again and again for webinars, which made me, challenge me to be on my toe tips, to be the best webinars, what is being happening. And I hope I have done my duty to deliver a good webinar. Sir, I hope I have not, disappointed you. Thank you so much, Ali Rani sir. You are such a legend yourself. Thank you so much. I never expected you to be listening. Thank you so
God bless you.
much.
God bless you. Thank you.
Yeah, thank you so much, sir. Thank you, Chandramohan sir. I think we can conclude. And tomorrow we are going, yay, world record.
Yes, yes. See, you started celebrating.
Yes, I started celebrating long back.
I request Duna madam, Rupesh also wish all the physiotherapists, so that I will end wishing everyone. Take 30 seconds, please. Not more than that. We will conclude.
Definitely.
You can
Sir.
wish Ali Rani sir and Vairav. Vairav is there.
Yes, sir.
Send your wishes to Ali Rani sir and others. Please take the chance.
Yeah, sir. So first of all, I thank Rejisha ma'am for this wonderful topic on a day before World Physiotherapy Day. It is again a much needed topic, and we have created awareness for the season, that is COVID season in this era. So thank you for that, ma'am. And I thank Ali Rani sir for attending this and making all the students inspiring with your speech and your presence actually. So your presence itself will give all the students a great effort to learn and take physiotherapy to next level, sir. Thank you for it, sir. And I wish all the participants from India and abroad a happy World Physiotherapy Day 2020, and be safe and be happy actually, so that our COVID will not be attacking us and we can serve people happily. Thank you all.
And Duna madam, are you there? Vairav?
Yeah, sir, I am here.
Yeah, send your
Thank you, sir,
wishes to
for
Ali Rani
giving
sir.
me this opportunity to speak out, actually. I would like to thank Dr. Ali Rani, sir, for joining with us in this occasion, actually. Thank you, sir, for wishing everyone. And thank you, ma'am, Rejisha ma'am, for such a nice presentation for everyone. Even not being a person from, physiotherapy field, I never felt that I'm apart from this. I have always included myself in this. And I'm so happy for being a part of ExRx India. I would like to wish everyone a very happy physiotherapy day. Enjoy and stay together and heal us, heal everyone. Thank you.
Thank you. Vairav, are you there?
Yes, sir.
Yeah, please send your wishes to Ali Rani sir.
Sir, hello, sir. This is Vairav, sir.
Course physiotherapist.
Co-physiotherapist from Chennai, sir. Like, it's been a pleasure working with, spending time with Chandramohan sir for this whole event, sir. So he's been working on he's been pulling heaven and earth together to make this event a wonderful event. So I thank him for this wonderful opportunity. And it's been a pleasure traveling with Chandramohan sir and ExRx India team. The great work has been done by Chandramohan sir and Rupesh and Dona ma'am. So I thank him a lot for this opportunity. And I wish all the co-physiotherapists and budding physiotherapists and upcoming physiotherapists a world happy and prosperous World Physiotherapy Day. Thank you. Thank you so much, sir.
Thank you. Thank you.
Thank you. Thank you. Let me conclude. Dr. Ali Rani sir, I wish you a very happy World Physiotherapy Day, and we are going to rock tomorrow. And I want your presence to be there when the announcement is going to happen, and also evening to distribute the world record certificates for our participants, resource persons, hosts, and all. And we have distinguished guests also to be with you. We have some entertainment also. We try our best to entertain, because all these days we never entertain. We give knowledge. We want everyone to be happy for the whole physiotherapy day also. So we made some other arrangements also, playback singers, mimicry artists, all those persons. So we try our best to make everyone happy. Stay happy always. That is the best thing you can do. Nothing you can change. Just you stay happy and be polite, be helpful to others, uplift others. Never ever expect something from others. Just give, automatically you will get. No need to ask for everyone. So treat your patients wisely after learning the real essence. Okay, so that you can grow more in your profession also. This is for the budding physiotherapists and even those who are practicing for 10 years or 15 years like me. I wish Rejisha Madam a happy Physiotherapy Day, World Physiotherapy Day. And also thank you so much for a wonderful session. You always rock. You always rock. And I thank Annie Madam for allowing you to take webinars for us. And also I thank Shankar Ganesh sir for introducing me to you and Annie Madam. Such a gem link I got. I can say friends like that. So yeah. So I thank Dr. Shankar Ganesh also. And I thank Vairav and Rupesh about Happy Physiotherapy Day. Happy World Physiotherapy Day, sorry. And I thank all the participants from almost 25 countries. I wish you all happy World Physiotherapy. Thank you all. Bye-bye, sir. Bye-bye all. Good night.
Bye-bye.
Bye-bye, Rejisha Madam.